to the market introduction section, and let's invite Elisabeth Roider. Hello, Elisabeth. How are you
Hello.
doing?
Good. How are you?
I'm really good. It's such a pleasure having you here today to present, and I think the audience is really looking forward to getting your insights into the vertical itself. But whenever you're ready, feel free to kick off.
Super. Thank you very much. Thank you very much for inviting. You can see my screen, I assume, right?
Yes, correct.
Super. So thank you very much for listening. Welcome to the longevity market introduction. It's my pleasure to be here. I'm speaking out of the role as a partner and the Chief Science and Medical Officer of Maximon, which is a venture studio in the space of longevity. My colleague Tobias Reichmuth will speak about the details of the company later. In the 10-minute presentation, I will start with a market snapshot where I would like to highlight that the field of longevity is not 100% defined yet. So you might have heard of people saying, oh, longevity is about living forever. Other people say, oh, longevity is about very tangible solutions like supplements, lifestyle interventions, what we can do today. What is clear that in addition to a very big traditional healthcare market with about 12 trillion, we know that there's also existing a consumer healthcare market, including wearables, fitness, Oura rings, nutrition supplements, and so on, that is already existing. In addition to that, we can define a market, which we call here longevity market, with around 30 billion, where it's really about preventing the root causes of aging. Here we speak about very specific measures like caloric restrictions, supplements, and cutting-edge therapies. Why is this relevant? Because in contrast to the traditional healthcare market, which is targeting specific diseases, here we speak about a very early prevention where we really understand what the individual is having a risk of and how you can target that in a very personalized way. So if we speak about companies, market sizes, what can we see here? What we see on the left side is that on the one hand, we have this very classic biotech approach to longevity. Here we speak about cellular reprogramming. So what can we do on a cellular level to reverse any kind of signs of aging or to prevent further aging? On the second hand, here also longevity discovery platforms, like broad platforms, classic drug discovery approaches where we want to find novel innovations, and of course the regenerative market. Other approaches, neuropharma, immunity, and so on, is all very similar to what we know from big pharma approaches, what Roche, Novartis, and all the big players are doing. I would like to mention also, given what our company is doing later on, that it's very important to understand that longevity is not only biotech. There's so much more. This includes digital health solutions, you all see the market sizes on the right side, different diagnostics platforms, which are super important because you always need to understand what is your risk of developing a specific disease or disorder on a genomic, on an epigenomic level. Here, more and more data is coming out, information about mental health, a lot of telemedicine, a lot of platform thoughts, and of course, nutrition supplements, very big and hot market upcoming at the moment. So key sector opportunities. Here we did our own research and homework to understand how do CAGR competition match in this kind of what we call longevity consumer market. So this is not only about the biotech space, this is really looking at that in a much broader way. And what we can see here that highly underserved areas include the market of femtech, so female health, because simply half of the population is female, and this has traditionally been underserved, and now really a lot of players coming in. The second part, I also had to smile when I read about that, but it's very true, animal longevity. So people are willing to actually spend more money on their pets than they actually do, than they want to spend on themselves, or even, very interesting, than their babies. There's market analysis on that. And of course, early cancer detection. We have been very successful in treating cancer, like different kind of cancers have been covered by big pharma, but really understanding on a personalized cellular level, what is the risk to develop a specific disease? And then from there on also, how can I further move on, diagnose that and treat that? That has been coming over the last few years and is going to grow quite dramatically. Investment trends, what we see here is that longevity itself is more or less following the traditional market. What we can see here, if we speak about longevity financing deals, we speak about single-digit billion numbers. Here we have annual VC investments as a trend match to that. Here, numbers and deal size, what you can see here as well, we have about between 100 and 300 longevity deals. Here then average deal sizes sometimes vary with 1 or 2 big outliers, but in general, this whole trend of longevity is matching the general trend we see in the market. Here, this is more as a general information. On the left side, we speak about longevity biotech-ish IPOs, big deals that have been happening. We know that Google, Altos, all of these like big players have been coming on the market. They're kind of secretive on what they're doing. On the other hand, I have a lot of friends working there, and it's a lot of age-related disease. There are a few platforms, Unity, Allocator, who really try to identify specific targets that are able to target aging. On the other hand, what we see that there's a stochastic model behind it that is not necessarily a single drug intervention that will play out. But but for sure, it's very interesting that these big players are coming out. If you here look at consumer health startups, then we have indeed also unicorns, Whoop, where maybe you know about the wristband, AG1 supplements, very strong marketing, tonal about the fitness, all of these kind of things. I would also count into the longevity market if we interpret it in the way that it's coming right now to really target any kind of age-related disorders at its root. So what is the unique value proposition in our case? I think it's very important that you see, and that's for sure my opinion, longevity not about exclusively extending lifespan. So what we see is that people are getting older and older. We have been tremendously successful in that path, but at the same time, unfortunately, the proportion of healthy life and sick life has not changed so much. So we have unfortunately gained mainly in sick lives, not so much on healthy lifetime. And that's also a problem that we now see with our current healthcare insurance problematic, that it's just getting more and more expensive. People are getting older and older, and they're not getting healthy older, they're actually getting sick older. And that also what drives our healthcare costs through the roof. So in my opinion, longevity will come not only because some billionaires are interested in living longer and want to support the topic, but also because really policymakers, governments, healthcare insurance companies, and I'm speaking with many of them at the moment, we're very close to signing deals, want to target and tackle this problem as a root, because otherwise we will have serious issues in the next upcoming years. So why now? Why is this whole longevity topic coming now? Well, for multiple reasons. One is the population pyramid and the healthcare cost I've been mentioning. The other part is that there are also data coming out, and scientific data, where we're able to more or less understand what drives aging. It's not that we know like step ABC is happening, but we know is that there are many scientific breakthroughs that have been happening over the last decades that are finally now bundled in a way that we say, at least we have a framework where we can orientate on and which hallmarks, what they're called, and we can target to hopefully stop aging, reverse signs of aging, and to really work in this space. So what are the challenges and outlooks here for the last 2 minutes? What we can see, well, on the one hand, we have the consumer skepticism because people horribly overpromised things and underdelivered. I think that's finally changing. Also, a problem was that scientists went into and it was not a medically driven discipline, but that changes. We have now clinical trials upcoming. We have MDs, so doctors really taking care of this field. We have a regulatory uncertainty because it's not an established board certification, not a medical discipline where we know whatever SOPs, guidelines, and so on are in place. So all of this field is finding itself. We lack a bit the hard definition of longevity, so probably this promotion of health span, what I mentioned earlier, will make it. We still have, if we speak about biotech, same problem. There are long developmental therapies at the moment. If we speak about biotech longevity, most therapies are in an experimental stage, and also lack of clinical endpoints. So still with all these clocks, we're searching for proper endpoints that can be used to really have a proxy to monitor which of these therapies are right. I think this slide mainly refers to biotech, and that's also a reason why our company started in this consumer health, where only applications that are already tested in human clinical trials have been used. And so what are the promising areas in the launch bio? So in the biotech area, we have the epigenetic programming, very interesting gene and RNA therapies. We had Nobel Prizes around these topics. So probably it will start that we have specific endpoints, specific genes that are targeted, drug-based therapies, first off-label use, so existing therapies, existing drugs that are used for longevity purposes and are repurposed, and then later on novel drugs, cell therapies here, if we basically speak of reprogramming cells, having different interactions, that it's rejuvenated. Then on the consumer health side, we have these wearables, what we all discussed about continuous glucose monitoring, smart watches, Apple, but much more than that, all of this combined in a way that we can get insightful outputs here. AI obviously does play a role because every step we do virtually and literally can be monitored nowadays and thereby really help you to generate outputs in a very personalized, helpful way. Digital health solutions, not only for female health, not only for mental health, but in general, that's a very big boom. And of course, supplements, nutraceuticals, all kind of drugs, supplements, helps that are outside of the medical space, very, very, very hot at the moment as well. So with this, I would like to close my market introduction. Please feel free to send me an email. If there are any questions, you can find me on LinkedIn or can reach me by email. Thank you very much for listening.
Thank you, Elisabeth. Super insightful. We have a question here. Can you elaborate on how this market compares to traditional healthcare in terms of regulatory challenges and time to market for new products?
Mm-hmm. Well, look, I mean, it always depends a bit what you compare it to, right? If you speak about longevity biotech, it very much compares to classic R&D biotech development, what, let's say, Roche, Novartis, any kind of spin-off of the big university does. And there we have traditionally long developmental pipelines, so at least 5 years, often it's between 10 and 15 years. We see a big jump at the moment with AI because we have a lot of steps can be modeled at the moment. I think here we see in the next 5 years a pickup in speed even faster, what would be wonderful, but status quo is it's as slow as the rest is, maybe even slower because scientists from university cannot access governmental funding. If as longevity is not a predefined discipline, you cannot apply at the whatever American Longevity Society and get $1 million to support your clinical trial. That's actually really a problem. And I think that's one, this file is defined. It's basically, it will be quicker. On the other hand, on the consumer side, I would say it's the same as if we have in the tech side and the supplement side and so on. Here, a lot of money is flowing to this market. So I think here it's almost faster to what we see outside. But here the regulation is a bit outside of this classic FDA approval process, what makes it much freer to act in.
Yeah, okay, makes sense. And then another question here, we've seen some projections of 5 to 10% growth above traditional health markets. How sustainable do you believe it's in the long term?
I mean, at the moment, it's considered as a mega trend. Of course, there were mega trends which did not end up becoming a mega trend. In this case, I believe so, and I can only basically emphasize again on what I said before. Yes, there are Jeff Bezos, etc., who are interested in this market because they have a lot of money and want to live forever. And I think these are the very early pushers of this movement. But reality is just that people are getting older and older and we are treating them. Our healthcare, I mean, I'm a doctor by training. Our healthcare system is just not sustainable anymore. We need to move in early. People will be incentivized to move more, eat better. Sugar will be taxed, in my opinion, similar to what smoking does. So I think there will be quite heavy regulation coming in. And from this consumer health, I think longevity will be pushed in and that's the trend I see at the moment. We know that at the beginning, there was this wellness trend, the cosmetic trend, right? People were exercising, Arnold Schwarzenegger, then all this aesthetic beautification, Botox filler, and so came in. And now I think this longevity is taking over where you say, okay, from internally, you are able to in the next 20 years. And I think here, these lifestyle changes, behavioral changes, plus pressure from outside will push this towards a true megatrend. So I think it will exceed the prediction we have at the moment.
Yeah, makes sense. Really good. Thanks for joining us, Elisabeth, today. This has been really, really insightful, and I think the audience really enjoyed this and got a pretty good picture of the longevity team as a whole.